My name is Anna Fiola. I am the Senior Clinical Director of the Woonsocket, Rhode Island Center. I've been with ACP, it will be 7 years this August. And I became a BCBA with the company in 2019. So the work that we do at the center is to help the kids increase their communication, increase their social skills, and decrease those restrictive and repetitive behaviors that are in the autism definition of the diagnosis. Different programs that we run with the kids are all to increase those skills that they may be lacking in or they may have deficits in, but also to give them these more functional skills that may be causing them distress. Like they may not be able to communicate, I want this juice, or I want to play with this toy, or I want to go to this place, but giving them a way to communicate that to us is helpful for like not only the kids' mental health, but like the parents, and they can have another functional way for their kid to communicate. Our clients are so little when they come in that they might not fully understand what that diagnosis is. But for some parents, it might give them this peace of mind of like, oh, everything that I've suspected now has meaning, or now there's a community behind it, versus there is that negative impact too of sometimes it's like parents sometimes grieve their kids of, okay, well, I don't know what my kid will be able to accomplish one day, or it's kind of like, I don't know if am I always going to be able to support them, or how much support are they going to need in their life. We have had a lot of parents come in not really knowing where to start, and that's at age 2, say, and then the kiddo is graduating, turning 5 at the end of the summer, starting kindergarten, and it's been really cool to see that kind of timeline with the parents and with the kids at the same time. It could be daunting at first, but knowing that there's a support system of you have your BCBA in your court, you have a speech pathologist, you have an occupational therapist, you have the BTs that are with the kids all day, every day. You have a whole close-knit team working for the kids' progress. Getting an autism diagnosis or having autism, it's not this bad connotation or anything. It's, you have this team of people behind you, you have this community, you have this sense of belonging with other people that understand you and what you might need or any deficits you might have. So everybody is trying to help make your, get more functional skills, have more functional communication, be able to have social interactions, be independent, and it's not just one person's job, it's a whole team. So we try to do a lot of fun things at the center. So we've done potlucks, we've done gift card raffles, we've done theme days, spirit days, we've even tried doing outings, or like just getting food delivered here for the staff. I also ask staff, like, do you need a break? I know there's been a lot going on, there's been a little bit of a tougher session, do you want to just step out? I'll take over. Or asking if they want to switch up of kids when they've been on a kid for a really long time, because burnout does exist, and asking somebody if they need a break or if they just need a minute goes a long way. I'm really like putting those mental health days out there of like, hey, if you are having a bad day, just say the word, and we can make accommodations, or we can switch up the kids a little bit, or just making sure that they're taking time for themselves too, like making sure they're taking time off. But we also, little plug here, we have an ACP book club that we pick a book every month and we discuss it virtually. So it's like a nice little like hobby that we get to do outside of work, but it's everybody that whoever wants to join can join. And there's a new ACP run club that is just starting out. So if anybody wants to join, they can.